brings wealth, and a healthy population remains the foundation of every thriving society. In Ondo State, under the administration of Governor Lucky Remisoy Aiyedatiwa, a transformative partnership with the World Bank is changing the face of primary healthcare delivery from the creeks of Ilaje to the highlands of Akoko. This partnership, implemented through the state's development agency known as IMPART, a purposeful collaboration between government, community, and global development partners. Across all 18 local government areas, the story is the same: revamping and upgrading of primary healthcare centers to strengthen grassroots health systems and ensure no community is left behind. From the southern coastal settlements to the northern uplands, geography defines not just the landscape, but the level of access to healthcare itself. Each center follows a uniform design and construction standard, ensuring quality, safety, and sustainability. Key components of the upgrading include comprehensive renovation of existing facilities, construction of staff quarters, construction of security posts in every center for improved safety and monitoring, installation of solar power systems for uninterrupted 24-hour electricity, perimeter fencing for controlled access and security, provision of borehole water and recirculation systems, supply of medical equipment and furniture, distribution of tricycle ambulances for referrals, ensuring that even in remote communities, medical emergencies are not left to fate.
It requires that we construct the staff quarters, we renovate the PHC's buildings, that's the primary health building. We supply solar power, we supply ambulances, tricycle ambulances. You will see behind me, these are some of the tricycle ambulances.
See, fence is also involved. As for here now, we have almost completed the fence. And fence is involved, solar is involved. There's a borehole reticulation. So ambulance is also involved. They have some equipment they have also to provide for the facility.
What you have seen the changes here is that when you came, you saw the staff quarters was ongoing because that one is new construction. Staff quarters was going on. I think that time it was about 50% completion. You can see for yourself now, the staff quarters is completed. It is wired, and solar system has been provided. 1.5 kVA has been provided, and you can see the main building. That the main building is equally wearing a new look, and it's being renovated, screeded, painted, and we needed to maintain the minimum standard. Minimum standard is that the delivery room must have toilets. We must have 2 consulting rooms, and we have to provide toilet for the male ward and the female ward. We need to provide toilet for the outpatients, and to provide some medical equipment. So we are at 99.9. Why I say 99.9 is that our borehole team that are working from other facilities that are yet to get here, we are supposed to provide water here for the facility, and we are going to dig a borehole. That fence also, we are working on that. Work is also going on.
In the southern belt, covering Ilaje and Okitipupa local government areas, the contrasts in landscape tells a powerful story of diversity and development. Ilaje, surrounded by waterways, lagoons, is a riverine region where access to many communities is by canoe or boat. Yet today, Elijah proudly boasts a quality road network linking previously isolated settlement to health care centers, a market, a testament to strategic investment and planning. By contrast, Okitipupa lies within an agrarian vegetation zone, a stretch of fertile land rich in forests, palm groves, and agricultural farmlands. Here, communities thrive on the rhythm of cultivation and trade, and the upgrade health centers provide vital medical access to farmers, traders, and families across the district. Centers in Lebute, Igodonlisa, Igbokoda, Odemai, Zion Kwekwe, and Odiaye 1 showcase how infrastructural innovation meets local need. Health centers rising above the environment, powered by solar energy and supported by clean borehole water systems.
We have 12 facilities in Ikale in Oktukwa local government and 11 in Ilaje local government. The Oktukwa local government facilities are Ibute. I think you've been there this morning. Idepe, Igodonlisa, Ilutitun, Ikoya, Ilutitun 1 and 2, Igbotako, Omotosho, Erinje, and Aye 1 and 2. So those are the 12 locations in Okitipupa. And in Elaje, we have in Bokoda, we have in Zion Kwekwe, Etika, Mahi, Lepe, Ayetoro, Ilekwete, Obenla, Odonla, and Molotein. And Ibegunre. That's all the first.
As the journey moves northward, the terrain transformed dramatically. The Akoko region, known for its rugged landscape and undulating hills, presents a different geographical challenge. Solid rock foundations, steep valleys, and scattered settlements that demand precision engineering. Centers like Oba and Owalusioka in Akoko Southwest, Ekan Ile in Ikare, Akoko Northeast, Agbaluku and Akuno in Akoko Northwest, and Itoto and Ekpeme in Akoko Southeast capture how each project adapts to the natural environment, blending modern infrastructure with the cultural and geographical identity of the land. Here, the centers stand firm amidst granite outcrops, surrounded by farmlands and red earth. The roads wind through ancient hills, connecting once isolated communities, now witnessing the return of reliable health care.
We just left Oba Akoko. Now we are in Owalosi Primary Healthcare Center. We have Okado Primary Healthcare Center. We have Owase Primary Healthcare Center. All in Akoko Southwest government. We have Ikomo Primary Health Care Center. We have Ekpeme, that is Akoko Southeast. Ekpeme. We have also another one in Ikpe, Primary Health Care Center. That is the two we have in Akoko Southeast. Now coming down to Ikare axis, we have a primary health care center at Ekonle. We have one at Ondo. We have another one at Agbaluku, that is Akoko Northwest. We have one in Arigidi, we call it Arigidi 1. Odiolo. We have another one in Akunu. We have in Iburopa, Private Healthcare Center. We have in Eshe, that is also Akoko Northwest. I think that covers the 16 primary healthcare center. What we are working on, the upgrade in Akoko, comprising the 4 local governments in Akoko.
Site engineers across both southern and northern zones emphasized quality assurance, adherence to professional construction standards, and the use of high-grade materials to ensure durability against environmental stress from the effects salinity of riverine soils to the hardness of Akoko stone.
Yes, there are standards. Of course, there are even World Bank standards, and it's a World Bank project. Based on the bill of quantities, all the standards there, we have met all the standards. That was as contained in the BOQ. We have met all the standards of the grade of the roofing, standards of screeding, that you must screed, so many other things. The mix ratio, standards. We don't do substandard job. We have met the requirements. We have met the standards as specified in the BOQ, so it will stand the test of time.
Very well. Even though in the BOQ, they asked us to use 9-inch block, and that is what we use throughout. I can give you, let me say, 99% assurance of the building, and I'm very sure it's very durable.
Challenges such as swampy ground in Odemain and rocky substrata in Omotosho and Ikare, including the environmental challenges that surfaced as a result of sea incursion in a coastal community like Ayetoru and an island like Zion Kwekwe, were carefully addressed through innovative construction techniques and adaptive engineering solutions.
In my Lagelu now, in fact, as you can see, this is a water lodge area. In fact, to build a building here is not too easy due to the topography of this place. But yet, we still keep on doing it. There's a lot of hill and mountain here, so to break it is not easy. Here, we face the challenges.
In the course of the project, we had a lot of challenges when we're trying to get materials for the job. For instance, we got our chippings, granite chippings, from Akure. By the time we got to Akumba, there's a barrier there at the university gate. Big vehicles cannot pass it, big trucks cannot pass it, so we have to offload those quantities there, look for a small vehicle to transload. And that for 16 facilities is massive. It was difficult. There are some places in Eshe that the roads are so bad, so getting materials down there was difficult. And of course, we reported back to Impact that these are the challenges that we have. Sometimes, during the rainy season, you cannot access your site, and it's difficult. However, we had overcome that. Health sector is a very important sector. And I thank God the government is giving priority to health sector because, especially in this rural community. For what really inspired me was for quality service delivery. With this, the staff will have accommodation. It will be easy for them to attend to patients. With this, the job will be easy. They'll be happy even doing their jobs without the provision of
safety and community engagement through our stage.
Sure, for the safety of the people around.